working properly. Researchers say the finding means contamination is more preventable and fixable. The Obama administration says it's turning off the faucet on Obamacare subsidies for those whose income does not match what the government has on record. Consumers will have until the end of the month to clear up the discrepancies. If they don't, some risk seeing their subsidies slashed or eliminated. They can still keep their coverage, but it will cost more. Nearly 9 in 10 people who got coverage also got financial aid. About 280,000 households have unresolved income questions. There are new questions tonight over just how good President Obama's signature health care law is for the American economy. What might surprise you is where those questions are coming from. Chief National Correspondent Jim Angle has the story.
It isn't just critics that say the health care law is hurting jobs. Several regional Federal Reserve banks found hard evidence that businesses are cutting jobs precisely because of Obamacare.
3 Federal Reserve banks in Philadelphia, New York, and Atlanta have surveyed the folks in their area, and roughly 1/5 of the employers are saying they've cut back on employment. Roughly 1/5 are saying they're moving from full-time to part-time.
You get a negative impact on jobs, you get a negative impact on the wages in those jobs, and what this means for small businesses as a whole is over $22 billion of earnings gone for their workers and 350,000 jobs.
The president has repeatedly delayed the mandate requiring businesses with more than 50 employees to provide insurance because of the negative impact. But businesses know it's coming, so many avoid hiring to keep their worker rolls below 50. Also, the mandate applies only to those who work more than 30 hours a week, an incentive for employers to reduce hours.
You have a kind of a natural cliff there that keeping your employees under that magic number doesn't ignite that issue that you've got to have health insurance.
We see this everywhere, that people are restricted, they're pushed below 30 hours, they count as part-time, and when they're part-time, the employer does not have to provide health insurance.
More than 1/3 of manufacturing firms in the New York Fed survey said they're raising prices to cover the cost of health care, and about half the businesses surveyed by the Dallas Fed said Obamacare is raising insurance costs for their employees.
Yes, we are going to see increased costs to employers who are trying to provide health care for their employees, but employers don't just take that lying down.
Even among full-time workers, their take-home pay is going to go down, because one thing that almost all the employers are doing in response to Obamacare is raising the deductibles, raising the co-payments, and making the employee pay more of the premium.
Today, the administration reported that 279,000 people still have discrepancies in their income data, which could mean lower subsidies, and their premiums may go up too. Officials also say 115,000 have still not resolved their immigration status. Their insurance will end if they don't clear it up by September 30th. Brett?
We'll stay on it. Jim, thank you.